Okay, so which of the following conditions is responsible for this patient's findings? So a 58-year-old man with a history of congestive heart failure presents a clinic for a follow-up visit. The physical examination, on physical examination, he has a jugular venous distension, lower extremity edema, and enlarged liver. Auscultation of the heart reveals a high-pitched blowing holosystolic murmur that increases with intensity during inspiration. An echocardiogram shows dilation of the right atrium and right ventricle and abnormal movement of the tricuspid valve leaflets. Which of the following is the most likely cause of this patient's finding? So we know that there's something going on in the right side of the heart, which makes sense because it backs up into the system, which causes like the whole like edema and enlarged liver. What I think is happening, considering the hollow systolic murmur, what were a part of the hollow systolic murmur? I know that the MVP is a part of the hollow systolic murmurs. I don't think it has anything to do with these ones. Could be pulmonary hypertension because it could be like backing up, like if there's hypertension in the pulms, could be backing up into the right side of the heart and then
Okay.
backs up to the system. I like that. I like that answer.
Okay, final answer.
Yep.
Okay, good. Yeah, so everything's mainly on the right side, right? So
Yeah.
it can back up and cause all that, right? And so
Mm-hmm.
the best one is going to be kind of that pulmonary hypertension, right? Lower, all of it is systemic and on the right side, right? Um, so echocardiogram shows right ventricular, right atrial and ventricular dilation with abnormal tricuspid leaflet movement. Further supports this diagnosis. Is a pulmonary hypertension is a common cause of tricuspid regurg due to increased pressure of the pulmonary circulation. And then you have that backup, and then all of a sudden you blow out kind of your tricuspid valve. Aortic regurgitation, right? Usually at the left sternal border, you're going to have a diastolic decrescendo murmur, right? Mitral stenosis, right? Usually kind of an opening snap. Rheumatic heart disease, usually in developing nations, and can cause kind of mitral stenosis. Systemic hypertension is usually left ventricular hypertrophy and dysfunction. But yeah, good. Everything points to the right side systemically, so this makes the most sense here.